Welcome back to today's Courage session. We are very, very excited for today's guest. Again, my name is Enrique Hasso, and I'm the Associate Director of the Texas Health Education Service here in Austin, Texas. We're housed within the TMD, SAS, and JAMP offices. So virtually right now, of course, I get to say hello to those folks over there. But today we have a really special guest. We have Dr. Peace Nwegbo-Banks joining us. And I will let her share some information about her journey. We do have some questions that we'd like to get through today, but of course, this is a courage session, so we do encourage each of you to ask any questions that you have. We will be here until 2 p.m. answering your questions. So first off, I definitely want to offer Dr. Nwegbo-Banks an opportunity to share her information about her biography and where she comes from.
Hi, everyone. I'm Dr. Peace Nwegbo-Banks. I am a JAMP graduate. I love JAMP with everything, and I'm happy to speak here today on the Texas Health Education Service. I am originally from the DFW area, born in Dallas. My parents are Nigerian. Graduated from Mesquite Poteet High School. Go Pirates. Went to the University of North Texas in Denton for my undergrad education, and that's where I got familiar with JAMP and got introduced to it. I graduated from Texas A&M Health Science Center College of Medicine out in Bryan College Station, and then I pursued obstetrics and gynecology for my specialty at the Houston Methodist OB-GYN residency program in the medical center area. I have my awesome husband, Eric, and we just had our son, Brody, about 3 months ago now, almost. And we like to hang out. He's growing and doing amazing. I'm also co-owner with my wonderful partner, Dr. Tamika Cross. We're co-owner of our OB-GYN medical practice. It's called Serenity Women's Health and Med Spa in Pearland, Texas. And we take care of women's health concerns and aesthetic services.
Wonderful. Thank you so much for that intro. And of course, I'm going to have a ton of questions for you related to your experiences, but I think you captured it quite well.
Thank you.
And so, of course, you did mention that you went to UNT, so I have to give props. You are one of the students that actually got to work with Dr. Deb Beck.
Oh, I love Dr. Beck.
She actually was the one that helped us kick off these courage sessions. She joined us for the summer as part of the Texas Health Education Service team. And of course, she did opt to go into full-on retirement. And I still get some really cool pictures. So Dr. Beck, if you are seeing this, hello.
Hi, Dr. Beck. She's the GOAT. She's the greatest of all time, was very influential in helping nurture my interest in medicine and helping me get there. She's so awesome.
Phenomenal woman. Yes.
Yes.
Well, I do want to ask, kind of like progressing from when you were part of JAMP and then talking about your med school experience, talking about your residency experience, and just what you're doing right now, because there's a really there's a unique purpose why we asked you to join the courage sessions. And we've heard a lot about obviously this application cycle. We have this huge influx of applicants that we'd never seen before, and it wasn't just an effect from that happened here in Texas with TMDSCS, but it's a national trend. And a lot of folks are calling it the Dr. Fauci effect, where you're seeing a lot of healthcare professionals kind of coming to the front lines and showing and really explaining to the general public how medicine is affecting them, and really explain some really complex themes to the general public. And I've actually, because you were a JAMP student, and that's where I started off with, I have actually been following your experience through Facebook, through your med school experience. And so seeing you at this point is really, it's really heartwarming for me to see how JAMP really affected your life. Yeah. But also, you're also turning your expertise as a physician, as an OBGYN, to really address a lot of disparities that are going on right now in the community, and really educating women, particularly women of color, on how to be able to communicate with their healthcare professionals and be well educated as far as what to expect throughout their pregnancy or throughout any needs that they may have related to the practice that you own. So I'm really curious, just first off, how, and I think this has to do a little bit with, kind of being a younger physician, a younger doctor. We kind of grew up with social media, and so you're kind of merging the two worlds. So I'm really curious to kind of hear your take on what it is that you do, and maybe offer some of those resources to anybody watching right now.
Sure. So, what I like to do on social media, or my thought process revolving around social media, is if you're not producing content, you're only consuming content. And so there was a point in time where people complain, oh, there's only this kind of stuff on social media. Well, let's be the change that we want to see. And so, coming from kind of like a more solutions based perspective, I was thinking, hey, I've had so many friends and family members ask me questions about pretty much similar things, or friends and family members that want a second opinion, or like don't really know where to get their information because there's so many different places now to get information. It's not always the most accurate. And so I decided to kind of like just have different sessions about different educational topics, and of late, along with the pandemic, different you know, societal topics in general, and just kind of talking about things from a science perspective. And so not from just pure emotion, because that's great and there's a place for that. But as a physician in sciences, bringing the science to it, bringing the data, and putting the information out there so people can make informed decisions. So social media has provided that platform where I could talk about various topics and really get to produce content.
And that I think pretty much settles it. You want to produce content and really be the change. I think that was a really strong message there.
Thank you.
We each have our part to play in this.
We do.
Yeah. So going back to the very beginning, talking about JAMP, can you share with us how JAMP was a part of your journey overall?
Yes. So the year that I joined JAMP, I believe, was the second year JAMP had been at least at my university. And so when I first got to college, I knew that I was interested in medicine, and I, went to the pre-med office and kind of talked, to Dr. Beck, and there was a poster, like a JAMP poster down in the hall. And I was like, oh, this is really interesting that, if you have a lower socioeconomic status, you can still have a chance to apply for medical school. I had no one in my family. I had no idea what it took. And JAMP literally, the program took me under its wing and shaped me and prepared me to be a quality candidate. I got shadowing experience, like, just in the hospitals, in the clinics. I got extra education. We were studying in the summer biochemistry before I even had the biochemistry course. Pharmacology, things like that, just giving you a heads up on what med school entails and what you need to get in, not including the MCAT prep, which was amazing. And so JAMP single-handedly prepared me and shaped me to be able to get into medical school. So I'm just always very, if there's an opportunity to like give back to JAMP, I'm always front and center, because it single-handedly is an excellent program. I didn't even mention the mentorship that comes out of the program. So, many of the attendings I worked with, different professors I encountered on my different summer internships, we have remained in contact, and they provide very quality, mentorship to me and my colleagues that were going through the journey. So I can rave on and on about JAMP. It's a very special program.
It really is. And we're definitely going to include some information here in the chat about the overall program of JAMP and how you can learn more information about it. Maybe this might be the first time you're hearing about JAMP, and so this is a great place to kind of get started.
Absolutely.
Yeah, and so you mentioned how JAMP kind of helped prepare you for the journey to medical school and the transition by like being exposed to classes and being exposed to that environment. So can you let us know what that transition actually was like for you? To get into medical school?
So the actual transition, getting there, okay, boom, get the letter accepted, and like there's all these feelings. Joy is one of them, but complete trepidation, because it's it's different. It's different, and you know it's different, but you still, even through the courses and stuff that we took in the summer, nothing can legitimately prepare you for medical school, except, you know, there are some post-bac programs, so I'm not gonna, you know, discount that. But the medical school experience really does come, you know, once you're in the thick of it. And so for me, the transition was the first block, because we do things by about 6-week blocks. I felt like, but you still, even through the courses, sorry. Can you hear me?
Yes, I can. Sorry about that.
Okay, no problem. And so where was I? Oh yeah, so the first block, I felt like I was getting information through a fire hose. So much information. The transition was, I would say, challenging, but it's because it's different. It's a different volume of work. So what you would do in a semester in undergrad, you complete in a few weeks in medical school. It's a completely different level of volume. Along with that, you're with a bunch of different people and you're trying to figure out the best way to study, what's your study style. And it can be, you know, intimidating. Somebody will come in with their $10,000 laptop and and they're just all spiffy and you have like your notepad. But at the end of the day, none of that matters. What matters is how you know, acquire the information and like keep it in. And so getting past some of those jitters and like really getting comfortable in the groove where there's typically a cadaver the first year. So you're incorporating that into your schedule and just really taking it all in. The transition is, there's a huge learning curve. And I think going in mentally prepared and being positive and optimistic about it and working as hard as possible are the best things to get through it and to get used to it as well.
Well said. So you kind of mentioned how that transition was, it could be a little bumpy, but ultimately comes down to what you bring to the table and how you're learning, how you're studying, and really taking on all that fire hose of information. So, you know, we always have like a mental image of what an experience is going to be like, and then the actual result. So, what was your, how did the actual experience compare to your expectations for medical school?
You know, So my actual experience was very different because I couldn't fathom. I think I could fathom a little bit the classroom part because we've been in school for most of our lives. So you can understand maybe, okay, I'm in the classroom, I'm getting lectures, whatever the case may be. But I could not fathom, like as mentioned, like, you know, the volume. And your lecturers are really cool. So all of our lecturers, typically in medical school, or I mean, everyone walking up there is a PhD, an MD, an MD, PhD. Like everyone's super brilliant in presenting, you know, so much information with minutia. So you're getting details along with it. Um, Knowing that I was going to be exposed to that much information is overwhelming now that I think about it. But I would say the third year was, I couldn't fathom that at all. Like just being a medical student, because third year and fourth year is clinical, or typically, you know, things are pretty different in each medical school. But for the most part, the first 2 years are classroom work roughly. And the last 2 years are roughly clinical hospital practice work. And so being able to actually be in the thick with patients, being in surgeries in the operating room, being in the back of the room when a patient is having there's a psychiatry session, being a part of that was such a privilege. And I don't think I thought about the privilege of that back before medical school. I still, it was amazing. I loved the clinical years.
Yeah, and it really is a whole different experience when you're
Yeah.
in clinicals and you are in the course. Because I think a lot of times, you know, people envision, you know, you're in the huge classroom setting and you're watching a lecture, and that's pretty much what it is. But there's a lot of hands-on that takes place.
Yes,
Yeah,
absolutely.
and it's all necessary, you know, for that humanistic approach to medicine.
I agree.
Yeah. So if you could go back in time, uh, I'm not going to say how long because I think we're similar age, but if you go back in time as a pre-med and, you know, pick up a skill that would have helped you, what would you do?
Hmm. I would say a couple of things. The first thing is I probably would have implemented the practice of like positive affirmations. And I know that sounds like, oh, that's not a big deal, but it is. Like being positive about the different things that one will encounter and, you know, letting yourself know hey, I've gotten this far. I'm intelligent. I'm supposed to be here. I deserve to be here. And positive mantras can be very powerful. There's a lot of, let me speak for myself. Something I had to face and that I still face is imposter syndrome, where you're just like, man, am I supposed to be here? Like, very few people look like me. What am I doing? And so being positive from that point in my learning and education and really like empowering myself through like positivity, I think would have been very helpful, especially done daily. It only takes a few seconds, not even minutes, to just, really be kind to oneself and remind yourself that you deserve the things that you have. That's the first thing. The second thing I would probably implement, if that I did not implement, I would say this for people who are morning people. Really, I'm a night person, so I've tried and it just doesn't matter. I'm naturally a night person, but I guess whichever time works best for you, whatever time, if you're a morning person, whatever the case may be, it is best to be a morning person because everyone else operates in the morning and you can get a lot done and really be, proactive and productive. But whatever your, productivity hour or time is, really take advantage of that time. Don't let that time pass you by. Really try not to procrastinate and get things done. If you can, you'll always thank yourself later.
Yeah, there's a reason why these sessions happen at 1 p.m. I think you hit on a really interesting note in terms of managing that imposter syndrome that seems to creep up, regardless of which profession. But I think really when you're talking about healthcare, becoming a healthcare professional, it might kick in extra, particularly for students who are first generation, who don't have even when you have the mentorship and you have somebody that you've connected with and you really understand the profession, you hit that wall all of a sudden. And I think it's really important to have that positive affirmation. And I just wanted to share my own experience with that. Kind of what finally made me snap out of it for myself.
Yeah, I'd love to hear
Might
it.
not be something for everybody, but it hit me. If I didn't have imposter syndrome, then I wouldn't feel that I didn't belong there. And so
Mm,
it kind of hit me. It's like I have it because I care about this and I know what the expectations are. And
correct.
I know that I can meet those because if I didn't, I wouldn't have this kind of like anxious reaction to it. And
Yeah.
so that's when I realized I was like, okay, I know what I'm doing. I can figure this out.
See, you
Uh,
know what? That's a good point because if you were basic or regular, you wouldn't feel like an imposter at all. You wouldn't feel anything. You'd be like,
you can I can handle the world. I can handle this. This is not an issue. So hopefully,
good
if that
point.
helps anybody out there, it's a great place. And of course, there are several resources you can find out there regarding imposter syndrome. And if it really is something that severely impacts your life, of course, there are resources available
Yes,
on your campus. A lot of counselors or coaches who can help you with that because, yeah, ultimately it comes down to this is a pathway that is not going to be easy, but
correct.
it's where you're meant to be if that's what you feel. And so you make it happen on your own.
That's a really good. I like the way that you wrapped your head around that. I'm going to steal that because
I
that's
saved y'all
true.
like 10 years
I,
of support there.
I love that
Yeah.
though.
So now I wanted to kind of ask questions relating to, we've talked about medical school, we've talked about your experience with JAMP, now actually going into residency program and kind of like
Mhm.
narrowing down all the different options that you had. Can I ask kind of like what moment really defined your desire to become an OBGYN?
Sure. So I previously mentioned in the beginning of the video that my parents are from Nigeria. And so when I was about 10 years old, my grandma, my paternal grandma, she came from Nigeria and she was with us in Dallas and she really helped shape us. Like we learned, me and my sisters already understood the language by the time she came, but we really started to speak it because she was like, I want to talk to my grandkids. And because we could understand in the mornings, especially, I remember the summer, I think I was about to go to 7th or 8th grade. And we would always eat breakfast together. She loved Eggo waffles. And so she would always tell me stories of when she was a midwife, because she was a midwife in Nigeria. She would always tell me amazing stories. I mean, good stories, some sad, but she delivered all these babies and delivered breech babies and was a midwife and performing midwifery without an ultrasound and, herbs. I mean, this was like 1940s, 1950s, 1960s through 70s, Nigeria. And so she was awesome. And she just told me so many awesome birth stories. And then I was so intrigued at that young age. And at that point, I was like, okay, I want to be a doctor. I want to be an OB-GYN. I want to do what my grandma did, and how do I go about that? And it was at that point, I was about 12, I would say, when I was like, okay, this is something I want to do. So she actually got to see my white coat ceremony. She passed away during my first year, but I'm very grateful that she at least got to see me get into medical school, to do what she did at the capacity of medicine.
What a legacy to uphold. That's fantastic. So you already knew you wanted to pursue that pathway when you went in.
Yeah, and I tried to be open-minded and always encourage my mentees to be open-minded. And I tried. I really appreciated my surgery rotation. I loved medicine, but like OB-GYN just pulled at my heartstrings.
Yeah.
And so, yeah, I knew I wanted to do that.
So you mentioned that with your mentees, you asked them to be open-minded. Can you kind of like share what advice you offer them when they're thinking about residency programs? Because just as you've come in to medical school, kind of knowing what the areas that you wanted to go into,
Mm-hmm.
some may have no clue whatsoever, or some may be really steadfast toward a particular residency that um, may not be a good match for them. So,
Sure.
do you mind sharing the advice that you give them?
Yeah. So what I would advise is, medicine is all encompassing. So even if you like a certain specialty, you can't have that specialty without your foundational, medicine. Before we even get to medicine, we're in pediatrics. Most of our patients will have surgery. Many of our patients will have specialists to take care of whatever medical needs that they have. So there has to be an overall respect for the entire field of medicine, just starting off. And I think that's where the open-mindedness comes. If you respect the field, you just kind of go in and respectfully learning all the information that you can and taking every rotation and every patient encounter, like take that in and really appreciate what that is. I think also a lot of different things that can affect our specialty of choice or a specialty that we really want to be interested in, especially like back in my day. Things are changing now, but it's the step 1 score. So some of your board scores will determine your level of competitiveness, and that's changing now, which is a good thing because it's moving to pass, fail, which helps people still get into their specialties of choice, regardless of that score. I think is where things are going to go. So respecting the process and scoring appropriately, depending on what you want to do helps. Also being involved in the interest groups. So if you're not sure what you want to do, there are various specialty interest groups that are small organizations that kind of give you more insight in the field. Conducting some research in that field too, just, getting published in some way can help. And I would also say, or what I also tell them in general, is if there is a specialty they really, really want to pursue in their 4th year, going to an away rotation and really working with the residents closely and at the institution that they would like to go to can help them further delineate what they'd like to do.
Excellent. And I'm glad you brought up the changes happening to the first step exam. That is a pretty major change that's sure to affect the overall match process. And
yes.
It's funny because you bring up the match process, and in my mind, we're still working with the application process here at TMBSAS, and we're gearing up for the match, which is happening in the spring. And all of the advice that you just shared for the national residency match is the exact same advice that I offer to applicants during the TMBSAS matches. You have to respect the process.
Yeah.
you really acknowledge which school you want to attend or which program in terms of the residency programs, and really don't try to game the process in any way.
Right. It's
I've heard, yeah, so many weird, bizarro explanations of, if I rank this school here and I won't get in there, but it'll guarantee that I get in here. That's not going to work. We actually
it's
have a
not.
match video, yeah, that really explains the overall process. But that's kind of where my mind immediately went to when you said
Yeah.
that. So if I could ask you to be a bit candid here, we often hear about challenges for medical school, but we don't hear too much feedback about challenges that you face during residency program. So
Mhm.
I'm curious to hear, what challenges did you, see? Maybe they might not be huge, but what kind of obstacles did you find along the way?
Yeah. So, residency is essentially like highly intense on the job training. That's essentially what residency is. And so there you're working, and I'll speak specifically from the obstetrics and gynecology residency because each residency and the requirements are different. But in OB-GYN, I consider us the blue collars of medicine. We work, you know, we're like catching babies. We're like running back for C-sections if needed. We're taking care of things. And so not saying anyone else isn't, I'm just, shouting out to my specialty. And so we work hard, easily 80 hours a week. Um, that's the goal, average 80 hours a week, but there are some times where you work more than that, 90 hours a week. And it's within the ACGME rules because your average time work should be 80 hours. So if we have a particularly busy week, you'll typically work like 70 hours that next week. So that can be an average of 80 hours. But we're working and getting used to that, getting your stamina up to, wake up very early and round, especially your first year. You're rounding, you're checking on patients, making sure they're fine overnight. Along with that, not only are you working really hard and spending a lot of time um, in the hospital or on your service, you have to study. And so the tests don't stop. So there's tests, there's quizzes to make sure that you're prepared for various procedures, surgeries, whatever the case is for, the specialty. I'd say for me, getting used to that level of intensity, that was challenging. My residency was a blur, like my personal life. You have to be mentally prepared to miss a lot of things. You are going to miss weddings. You are going to miss birthday parties. You're going to miss, certain holidays, depending on what the schedule is. I miss funerals. You do miss a lot of things, and that's something I don't think I thought about it. Like that. It's like you don't think about it till you're in it. I don't regret it. It's just it is what it is. That was challenging. Just being able to be like, hey, I can't go. I'm training, literally. Something else too, I would say for me is like you have to be open and ready to receive feedback from your upper level residents, from your attendings. They're shaping you from a med student who is essentially a passive observer to the physician. So you have to like be mentally be prepared for feedback, take all the feedback with an open mind and, take it in. For me, I was like, who are you talking to? A little bit, and that's not the right attitude. And I snapped out of that rather quickly. But in my upper levels, my chiefs were really patient with me, but that's a huge adjustment. And if you come in mentally prepared to take advice and to take feedback and to take the critiques, you will grow accordingly and be a better resident because you're just letting things roll off your back. You're not taking it personal. It's not personal. You're just really literally being molded into a surgeon and a clinician. You think very differently as a physician than as a med student.
Yeah, I can't even fathom what that transition might be like. I'm learning a lot from this conversation as well. So I mentioned this earlier, but one of the key reasons why I wanted to bring you on to talk on the current sessions was to really share what your life has been like now that you're in practice. And really, what I want to do is kind of challenge the notion that when we think about physicians, we think about doctors, and this could apply also to anybody who's looking to become a dentist or looking to become a veterinarian. is the experience is not restricted to a clinical setting. You're essentially becoming a leader in your community. You're really taking on um, a higher role beyond yourself, and I think that's one of the things that is kind of like a an output of becoming a physician or becoming a healthcare professional. Is you're suddenly it's like something triggers, and you all of a sudden become a selfless person and have other people's interests at heart. And so I'm really interested because I did take a look at your website, and you mentioned um, several times about working with indigent populations, which tend to be, folks that come from very low socioeconomic backgrounds, may have a lot of underlying issues, and this is a very difficult population to reach, particularly because they might not always have health insurance, might not always have access to health care. A lot of times, they might face individual issues that make them very difficult to be reached. And so I'm curious about what it means to you to work with these indigent populations.
Absolutely. Thanks for asking that. So my first 3 years after residency, I worked as a hospitalist with the University of Texas Health, which what that means is I worked in the hospital, and the patients that I take care of are patients who come in who don't have a doctor, or their doctor does not come to that hospital. They're considered unassigned. Typically, these patients that come in, they come in through the ambulance, typically because they may not have a vehicle, different socioeconomic issues from there. Many, did not have access to prenatal care. Many may have substance abuse issues. And so at the different hospitals where I covered as a hospitalist, and I work nights, so I got to see, everything interesting happens at night. I got to really work with a patient population that I really love. And typically, patients come in and they expect to be treated a certain way because they're not insured, or they should have delivered at another hospital. Why are they here? And what I always try to do during my encounters with these patients is, you know treat every patient with respect, regardless if you're insured or if you're not insured. Be highly respectful, still practice evidence-based medicine, and educate. So I really use that time to educate. Even if they came in and they weren't in labor, I would, some patients will come in, and this is random, this is not a real patient, but a 18-year-old with already 4 kids, and she's on her fourth kid. And, I would use that as an opportunity. Let's talk a little bit about contraception. What have been the issues? If you wanted 4 kids by 18, awesome. 100% of the time, no, they don't. And so we talk a little bit about contraception and places to go get some affordable contraception, et cetera. Things that they can do on their part to help them control their life. A lot of times with patients that are in a lower socioeconomic status, or who are indigent, there's a lack of control over what's happening around them. And so I always would try to educate, because education and knowledge, that's power. In the most recent capacity, since I've transitioned to private practice, I don't have access to that patient population as much as I did in the past. But goals that me and my co-owner of my practice, Dr. Cross, we plan to host fairs for our underserved in our communities within the next year or two. And we're in the planning stages of that, but have a fair to give people who don't have access to healthcare access to physicians, and get a PAP, or get a quick mammogram, setting that up. So that's something we're working on, just to try to continue to give back and offer some kind of help.
Excellent. Thank you so much. I was writing down some of those words in there that you were mentioning. I love that.
Thank you.
Is power. I think, I say this a lot, but I think we should put that on a shirt.
I agree.
Yeah, so when you open your merch shop, yeah, that's the first title. So, we talk about we've talked about your work with educating people and using digital platforms to reach a wider audience. And I'm curious to kind of learn more about how, in your role as a physician, you are working to inspire change in systemic issues. We've oftentimes heard of some really awful statistics about how Black women in particular are really um, in terrible positions, oftentimes because of lack of care, lack of access to care, or maybe lack of knowledge of working with Black women. And I'm really curious to learn more about how you've educated others, and particularly educated others that might be affected by these systemic issues within healthcare.
Absolutely. So I've done several talks about this and specific issue that you bring up, which is really important. And I provide advice. So I have some of my patients, my African American patients, my Native American patients who also have a high staggering rate of maternal mortality. I discuss with them how to go about navigating, the healthcare professional for them, because patients often say, well, what can I do? What can I do? We know that these are statistics, but what can we do on our end? And what I typically recommend is preconception counseling. These are for patients who are before achieving pregnancy. Preconception counseling can catch any underlying diseases, including high blood pressure, diabetes, thyroid problems, etc., prior to conception. Which what that can do from a foundational aspect is take care of things and have patients go in a bit healthier when they achieve pregnancy. That's the first thing I encourage. The second thing I typically encourage is, when a patient goes to an obstetrician for the first time, being candid about their concerns and fears. Hey, doc, I'm Black, I'm Native American. We have a high maternal mortality rate. Are you committed to helping me? And I don't mean that in a challenging way. And I don't mean that in a way to like put off the OB or the midwife, but more so in a way like, are you aware of this information? And will you provide me the particular attention that I need to mitigate some of the horrifying risk factors and things that, occur? The second or the third thing, and this is one of the more important things that I emphasize, is really being proactive in one's care. Like, don't leave your doctor's office if you don't understand what's going on. Request, patient information that you can read about later. Ask your doctor questions. So if you have questions, put them. I have my phone. All of us have notes. Get in your notepad and write down questions that you have, so your questions are answered when you see your clinician. Feel fully informed with different decisions that are made. Of course, some things may be an emergency, so may not be a lot of time for the doctor to always explain, but that's not always the majority of the time. So I think coming in as healthy as possible with preconception counseling, finding a doctor that's committed to you and not just kind of cursory in how they go about things, and playing your part and being informed and asking questions, and really kind of having no one's saying be a physician or clinician, but have a basic understanding of what's going on. Can you explain in your own terms what's going on to kind of understand how the pregnancy is going? That's what I would typically advise in these sessions. And something else I'm doing, me and a group of colleagues from different specialties, anesthesia, family practice, internal medicine, of course, obstetrics, we are in the process of putting out a racial disparities paper to kind of look at racial disparities from the past, present, and what we hope to see in the future. And so that's putting out data is a really good way. Once again, numbers don't lie, but putting out data is another way to help enact change by putting that information out there. So those are a couple of things that are floating around for me when it comes to those disparities.
It's very timely to bring something like that together.
Yeah, it is.
I'm excited to see that come together.
Thank you.
Thank you so much for sharing that. I think there's some really major things that we can take away from that, particularly as people, learning how to communicate with our physicians, with our caregivers, having that shared language, and really being able to communicate how different things are affecting us. But also the challenge as an aspiring healthcare professional of recognizing that you are being privileged enough to learn so many different systems, so many different terminologies, but also mastering them in such a way that you can communicate them with normal people.
Yes.
Because there are parts of the body I can't even begin to try to pronounce. And so just being able to communicate that back, and I think it comes from a place of studying and learning all of this, but coming from a place of humility. Uh,
Yeah, that's a
and
good
I think,
point.
and I think a really helpful thing for a lot of folks is to kind of have an image of a a client, or I'm sorry, of a patient in the future that you may be addressing. So it's like, how would I explain it to this person?
Yes.
Because yeah, I mean, when it comes down to it, um, there are a lot of issues beyond systemic racism issues, or issues with being able to communicate with doctors, but ultimately, as a physician or as a healthcare provider, being able to connect with your patients is a really key issue. And I think
Absolutely.
there have been several papers published about how, um, for physicians who don't have that connection, tend to be more susceptible to malpractice claims or suit.
100%.
Yeah, and that was actually one of the largest contributing factors for the changes that we've seen with all the medical schools, probably in the past 10 years, with regards to changing the MCAT and addressing, psychology and sociological behaviors,
Yeah.
and having that entire section of the test, and then also with having the schools introducing items like the core competencies, which I always, have the weight of bringing these into the conversations during our courage sessions, but they're very important because they're showing that before you become a physician, before you start engaging with patients, you do have these different traits that are important for you to be able to communicate and connect with other people.
Absolutely. I mean, think about if like you didn't like your doctor and then your doctor, then there was a complication. Of course, you're going to sue them.
Hmm.
You don't like them and they messed up. Like the least you can do is if you're going to be rude is to do a good job. No offense. I love my colleagues and complications do happen. So I'm not blaming anyone, but having a warm bedside manner, drawing out pictures if a patient may seem, confused, handing patient information. Those are just a few things that really help patients have a firm understanding of what's going on. And patients tend to do better and remain compliant, which is, take your medications that have been prescribed and et cetera, when they really understand what it's for.
100%. All right. Well, we are getting real close to time, but I want to make sure that we talk about the Serenity Women's Health and Med Spa. Uh,
Yeah.
can you share more information about that?
Yes. So, Serenity Women's Health and Med Spa is my private practice, co-owned by me and by my business partner, Dr. Tanika Cross. We are in East Pearland, Texas. We are like right in the beginning. We just officially opened in November, so we're brand new. We pushed through and built the practice through the pandemic. We take care of all women's needs from the age of 12 all the way postmenopausal, and take care of you from a preventative health standpoint, manage fibroids, um, infertility workup, and different things like that to help patients. And on the med spa side, we offer a level of convenience and aesthetic services for our patients, including laser therapy, facials, injectables, and IV hydration. Um, we have very experienced staff that are very knowledgeable and can help patients on both ends. But we really wanted to create a business model that was convenient for professional women. You don't have to run across town to get things done. You can come here and kind of take care of your needs. So we're really excited and we're looking forward to patient and client feedback.
Yeah, I was about to mention it's almost like a one-stop shop now.
Yeah.
That's fantastic.
Thank
All
you.
the best of luck to you and your
Thank you so
partner.
much.
This sounds like a fantastic opportunity for you both. Would you mind, for any students who may be watching this and want to follow kind of what I've been seeing and following you on your social media channels,
Yeah,
would you mind sharing what those are?
sure. Can you want me to put it in the chat or say it out loud?
You can say it out loud and I'll type it
Okay.
out so that everybody can get a hold of those.
Awesome. So you can find me on Instagram at dr.nwegbo Banks, and it's on the screen. No hyphen, just Dr. Period Nwegbo Banks. That's my IG. And my website for Serenity Women's Health is serenity-women.com. You can call for an appointment. You can follow me on Instagram. And, if you have a question, message me and I will try my best to respond or at least provide some kind of feedback.
Excellent. Excellent. Thank you so much for taking the time today and, sharing your experiences. Before we do let you go, I do want to offer you the opportunity. These are card sessions, and we talked earlier about how important these were for a lot of reasons, particularly the journey to medical school or to becoming a healthcare professional is already bizarre enough, and then you throw in a pandemic and it's just on the fritz. And so we built these card sessions with the help of Dr. Beck as a way to help inspire our students to kind of continue with their journey. There have been so many issues that we've addressed in previous sessions, like, canceled shadowing experiences and MCATs that have been postponed time and time again. We've had issues with interviews being postponed. And so this is all, it's to be expected. We are living in a global pandemic. But what we really want to do with these sessions is to really inspire students to continue pushing on their journey. So
Absolutely.
I'd like to offer you kind of like the last question here is, what advice do you have for students kind of right now, looking at you and saying, that's where I want to go?
No. Well, I want you to know that you can do it. You can do it. And you have to really, really believe that part. Because that's going to be the fuel. Medicine is a marathon, not a sprint. And so when you keep that in mind, you recognize that, these different issues from the pandemic, they do not cancel your opportunity. It's just a bit delayed, but it's not canceled. What I would advise during this time is to, don't lose steam. You can do, and this is newly developed, but UWorld, which is a resource that we use significantly in medical school, and it's very helpful in gaining the knowledge to do well on the board exams. They have an MCAT version called UWorld, and what it is their questions, like it's just a question bank that really teaches you how to think about the test, teaches you concepts, and what's best is when you miss, if you get something wrong, it's fine. The explanations are excellent, and it kind of help you gain a deeper understanding of why you may have gotten something wrong. I do Q-Bank questions a few times a week just to keep the stamina up, keep the thoughts flowing about the MCAT up so you don't lose what you've been studying for. I would also say if there are any opportunities to link up with physicians, virtual shadowing has become like an accommodation that's been made to help patients still get somewhat of an experience that they can put on their application as far as that goes. Along with that, yes, it is a pandemic and I completely, understand, but if one is able to add any type of community service to, the resume at any capacity, that always adds a lot of value. Being a physician often does require a level of selflessness. And so if you're able to do that in a safe way, it'd be really good to kind of like beef up your resume in certain ways and use this as an opportunity to improve your resume or add to your journey instead of, just kind of sulking. Sulking never got us anywhere. So just try to take what you can into an opportunity. If you can, hop on a research project. You can work on things virtually. There's lots of emails and phone calls and Zoom conversations that can take place. Take advantage of what you can and push. Don't be afraid to push, email, put yourself out there. That's going to be your life in a little bit, always having to put yourself out there. So just kind of get comfortable with being uncomfortable, because that's how you know you're doing better. And so that's what I would, encourage the students that are just kind of trying to figure out, this is a weird time, but take advantage of it.
Thank you so much. I'm writing all that down right now. Dr. Nwegbo-Banks, thank you so much for taking the time to talk to us today and sharing your experiences. This means so much to so many students right now who don't have the opportunity to shadow physicians. And so thank you so much for taking the time.
Thank you, Enrique. Thank you for having me. I'm really honored, and I'm rooting for everyone that's in this process. This journey is possible. You can do it. Just keep putting one foot in front of the other.
Absolutely. Well, on behalf of the Texas Health Education Service, the JAMP program, and TMDSAS, we'd like to wish all of our applicants and future applicants all of the best of luck.
Absolutely.
It's not going to be easy, but it's going to be worth it.
It will.
We'll talk to you all later. Thank you so much.
Bye. Thank you, Enrique.